Okay, good morning, everyone. I just want to do a little test. Can you hear me, Dr. Swingle? Okay, wonderful. Good morning, everyone. Welcome to our web show. It's all in your head. My name is Rita. I'm the moderator. And if the gray days of winter are getting you down, you are at the right place at the right time. Dr. Swingle will be talking about seasonal affective disorder. I've personally heard of few strategies to deal with this condition, from eating bananas because they contain the natural mood enhancer tryptophan to relocating to sunny Florida. I'm just not sure how many bananas you would have to eat or if you would want to move to Florida, but not to worry. Dr. Swinger will talk about a lot more effective technique to deal with the seasonal affective disorder, and that is neurotherapy. Before I invite Dr. Swingle, let me tell you a little bit about his background. Dr. Swingle was a G at the University of Ottawa prior to moving to Vancouver. A fellow of the Canadian Psychological Association, Dr. Swingle was lecturer in psychiatry at Harvard Medical School, attending psychologist at McLean's Hospital in Boston, where he also was coordinator of the Clinical Psychophysiology Service. Dr. Swingle is registered psychologist in British Columbia, certified in biofeedback and neurotherapy. His book, Biofeedback for the Brain, was published by Rutgers University Press. The book is available at www.soundhealthproducts.com. Again, that is www.soundhealthproducts.com. I also would like to encourage you to ask questions during this webcast, and Dr. Swingle will be answering these during our 2 breaks. You can just type your questions in the chat box located on your control panel and submit them. Okay, ladies and gentlemen, let's get going. Here is Dr. Swingle. Good morning.
Good morning. Well, as Rita was saying, we are in overcast, dreary Vancouver, so it's a good time to be talking about seasonal affective disorder. And the good news for Vancouverites is that most people who think they have seasonal affective disorder don't. And we'll be talking about a lot of the aspects associated with mood-related seasonal effects on mood. Okay, let's get started. First order of business, symptoms associated with what's considered to be seasonal affective disorder. And these are quite common: tiredness, fatigue, depression, crying spells, irritability, trouble concentrating, body aches, loss of sex drive, poor sleep, decreased activity level, and so forth and so on. They also talk about overeating, especially carbs, and weight gain. Now, a lot of these things, if you think about it, one of the aspects associated with seasonal affective disorder is it may be something that is a normal process. The body slows down at this time of year. And if you think of hibernation mode, we put on a bit of weight, we get tired, time to crawl into our cave for a nice winter sleep. So there are aspects associated with this that are accommodating, in a sense, to changes in weather in the northern climates. Now, the other thing that I think is very important is that seasonal affective disorder doesn't only refer to loss of light and dreariness and so forth of the winter months. Whenever you say seasonal affective disorder, everybody thinks November. The fact of the matter is you have seasonal affective disorder associated with springtime. And you have issues associated with much higher suicide rates in April than any other time of the year. There's also pretty compelling evidence that even in environments where there's very substantial light, mood disorders and suicide rates can be very high. Southern California is an example of that. Okay. There are normal seasonal variations. That's what we were just talking about. And the winter blues, a lot of folks will talk about that, the winter blues. And basically, again, I think what that really is the body's just slowing down. And it's a normal physiological reaction to change in the light characteristics, change in season and so forth. The body is slowing down, preparing for the winter. True seasonal affective disorder is rare. It's only 1 to 2%. Although we have huge number of folks come into the clinic at this time of year and say we have, that they have seasonal affective disorder. Typically what it is, it's most commonly associated with a larger illness. That is, individuals who are clinically depressed, they may go into a period of remission for a period of time, and the expectation that they are going to be more depressed as the light becomes, you have less light and cold and dreariness and so forth. So there's an expectation that can trigger a increase in depressed mood states. There are a couple of things that you can do. One is be careful about oversleeping. One of the problems that we run into routinely with folks who have very serious depression is oversleeping. And sleep can have a depressing effect. And we get a lot of clients who oversleep and always feel that they are tired, always feel that they need more sleep. And the fact of the matter is, the longer they sleep, the more tired they become, because they are in inefficient sleep cycles with the long sleep. Now, the other part of seasonal affective disorder, which we hear very little about really, is what I call April sad. And there's an interesting quote from T.S. Eliot about April being the cruel month. Suicide rates are very high during that period of time, relative to other parts of the year. And Eliot talked about January being unhappy, but April being cruel. Now, there are all kinds of mechanisms associated with what we call springtime seasonal affective disorder. As light starts to increase, activity levels tend to increase, you become more aroused. And there's an issue associated with empowerment, as a lot of clinicians talk about empowerment associated with increased suicidality. The primary marker for depression from a neurological point of view is when the right prefrontal orbital cortex, the right front part of the brain, is considerably more active than the left. Now, there are a lot of ways that that can happen, and we'll go through a few of these. But basically, one of the primary ones is associated with elevated beta over the right side of the brain. Now, beta is a very fast waveform, 16 to 25 cycles a second. And it is a brainwave associated with activity. And when you get marked elevation of beta on the right relative to the left, that's your primary marker for what I consider to be genetic predisposition to depressed mood states. Now, this may be triggered because of a lack of light. And under those circumstances, the individual is having a depression, a period of depression that coincides with dreariness in the weather or with expectation that they're going to become more depressed, or expectation of an unhappy time of year. A lot of people do not like Christmas holidays, for example. They are associated with unhappiness, family strife, and so forth and so on. And the anticipation that they're going into that season can trigger a depressed mood state. However, we would not consider this seasonal affective disorder. We would consider this straightforward clinical depression that gets either exacerbated or triggered by changes in the weather. So from my perspective, high frontal beta on the right side of the brain is not seasonal affective disorder. Now, this is one of the areas in which some cognitive behavior therapy may be useful in terms of, because the light is decreasing, because you're becoming a bit more sluggish, because you're going into a time of year that's unpleasant, doesn't mean that you have to be depressed, basically. From a neurotherapeutic point of view, what we do is correct the imbalance. And we do that with neurotherapy by decreasing the elevated beta on the right side of the brain. So this is a situation in which seasonal affective disorder is part of a larger illness in the sense that it is associated with a neurological predisposition to depressed mood states and low light triggered relapse or triggered exacerbation of that larger condition.
Okay, this break. If you want to stay informed about our future events and webcasts, please make sure you subscribe to our newsletter. You can do so through the homepage of our website, www.swingleandassociates.com, or through the homepage of our product website, which is www.soundhealthproducts.com, which has been completely redesigned and launched just a few days ago. And we have a first question. Dr. Swingle, I seem to get sick around November every year. Is this part of seasonal affective disorder?
That's a very interesting question. And we get a lot of folks who come in and they feel that they're more vulnerable. Now, one of the things that we do when we're treating immune problems, for example, our cancer patients, there are several things that we do, one of which is to take care of any predispositions to the depressed mood state. Because as you know, there's a relationship between depression and immune inefficiency. So my answer here is that, yes, I think what's happening is you probably have a predisposition to depressed mood states, and the low light is triggering the increased depressed mood state, and that is having a negative effect on your immune efficiency. You may, in fact, have a bona fide seasonal affective disorder. And bona fide seasonal affective disorder, of course, means you're depressed, or at least that's one of the components of it. And that also could suppress immune efficiency. So I think it's probably correct. So if you take care of the depression, you probably take care of your increased vulnerability to cold and flus.
My doctor gives me antidepressant every year around October, and it seems to work okay. I come off it around February. Is this okay?
Yeah, my feeling is if it works, fine. It all depends on what kind of side effects you have and how easy it is to wean yourself off. I don't have a knee-jerk reaction against that. My preference would be to have a look to see if you have any vulnerabilities, any predispositions to depressed mood states. And if that's the case, what I would do is suggest some neurotherapy or some home treatments that will take care of that in terms of correcting those imbalances, and then see how you make out. So you may be able to correct the neurological predisposition here and not be dependent on the medication. But, having said that, if the medication does the job and you don't have any negative impact of it, so be it.
Okay, and we'll take one more question. My wife gets depressed every November and stays in bed till March. She sleeps 12 to 14 hours every day. I tell her to get up and do something and she won't be depressed.
Well, I think you're probably right. But don't tell her I said that. Uh, there's pretty good evidence to indicate that if you restrict sleep and get up and start to do things and get involved, that it has a very positive effect on mood state. So I would encourage you to plan some things together. Figure out what you're going to do to get up in the morning and get out and do something. I think, that's a pretty good idea.
Thank you, Dr. Swingle. We'll move on.
Okay. Let me get rid of that. And here we go. Now, there's another type of depression markers that we get with seasonal affective disorder, and this is what it looks like, in which we have a elevation of slow frequency over the left and a mild elevation of beta on the right. Now, my data indicates that when you get these low frequency elevations over on the left, for example, alpha, 8 to 12 cycles a second, that's more likely to be reflective of experiential impacts on depression, expectation, going through some negative experiences and so forth, where you have a mild predisposition to depressed mood states. This is what seasonal affective disorder often looks like when we see it. And there have been a number of experiments in which they've monitored alpha in the right and the left side of the brain, and then expose the person to some information that is sad, so that they're trying to induce a sad mood state. And it might be reading material that is depressing, about I don't know, something happening to a child, negative happening to a child, for example. And this is the research done by Rufus and Elsa Baer, in which they showed that if you could induce a negative mood state, a depressed mood state in individuals, you would get a correlated change in alpha, in which alpha would be higher in the right relative to the left. Now, when you have the shadow beta marker, and that is a situation in which, generally speaking, the client isn't depressed year-round, it just starts to happen with this restricted light situation that they're going into. This, I think, is probably the brainwave pattern that's more associated with what I call true seasonal affective disorder. Another condition that we run into very frequently, and not only during the time when people are more prone to seasonal affective disorder, but also individuals that are prone to what I call springtime seasonal affective disorder. And that's where they have a deficiency in the back of the brain. And this is an area of the brain associated with quieting sleep, reduced chatter, being able to find peace in your own head, and so forth. And when there's a deficiency in this area, people are very they have a problem with stress tolerance. And I think often this can be associated with people feeling better in the fall, and where they go into their problem of elevated anxiety, elevated anxious activity is in the springtime. So this is more like the more likely pattern that we find in seasonal affective disorder associated with problems in the springtime as opposed to the fall. And that's where there's a low theta beta ratio. Now theta are brainwaves from 3 to 7 cycles a second. Beta are brain waves from 16 to 25 cycles a second. And roughly you want twice as much beta. That is, the strength of beta should be about twice what the strength of beta is in the back of the brain. So theta beta ratio is sitting up, roughly speaking, around 2 is what we want to see. When they get really low, under 1, for example, these are the people we tend to see around in the springtime who seem to be doing more poorly. Now, early on, the therapists used to think that part of springtime seasonal affective disorder and part of the springtime marked increase in suicidality had to do with a psychological issue. And that is, people were seeing everything blossom. The flowers were coming out, the trees were budding, birds were chirping, eggs in the nest, all of that. Life was starting again. And it was just too overwhelming for some people. Like, my life is not starting over again. My life is terrible, etc. And the comparison of the way they felt versus what they saw in the environment around them was giving rise to this marked increase in depression. Because of elevated light, they were more aroused and activated, so that they were more prone to act on suicidal ideation. That was the old notion about what was associated with this. In addition to that, I mean, that's a plausible kind of hypothesis, but on top of that, what we typically find in neurological predispositions, and one of them, the biggie here, is deficiency in the back of the brain. So the individual is not good at stress tolerance. They also tend to have, in my experience, that shadow symptom associated with predisposition to depressed mood states. Okay. Another condition that we see very frequently in people who announce themselves as having seasonal affective disorder is what I call the trauma markers. Now, when we're doing a intake assessment, looking at the brainwave activity of clients that come in for treatment, one of the things we look at is the difference in alpha. Now, remember, alpha are brain waves from 8 to 12 cycles a second. And we look at the strength of alpha, eyes open versus eyes closed at those two locations, CZ and in the back of the brain. Now, when people close their eyes, there should be a very substantial jump in the strength or amplitude of alpha. so that at location CZ, for example, CZ, if an individual closes their eyes, we expect a jump in the strength of alpha of at least 30%. And in the back of the brain, we expect it to be much higher, at least 50%. And when we see these conditions of blunted alpha, then very often what that is a marker for a history of exposure to severe emotional stress. Now, one of the things that happens when individuals have these trauma markers is that they are prone to depressed mood states because of their experience. Now, typically they also will have some markers up in the front associated with neurological predisposition to depression. The other thing we often find with the trauma folks is as they become slowed down because of the normal physical response to the coming of winter, that in that quiet environment, the trauma, the emotionality associated with the trauma is more likely to emerge. This is that concept of you see ripples in a calm pond. So the treatment for this condition is to treat the trauma. And there are ways that we do this. In neurologically, what we do is normalize the alpha response. And when we do that, we usually get an emotional reaction to it associated with the inherent trauma experience. And then we help the person with a variety of different techniques, EMDR, OEI, SER, and so forth, hypnosis and so forth, and regular psychotherapy to help the person redefine the emotional meaning of the experiences that they've had. And not the next webcast, but the one following it, the one in December, we're going to use the entire webcast hour to talk about the treatment of trauma. Okay, the summary of seasonal depression. The first thing that we talked about were some imbalances in the front part of the brain, and that's where the right side of the brain is more active than the left. And there are a lot of ways that can happen. And the first four items here are different brainwave configurations that will give rise to that. That is where the right side is more active or the left side is less active, so that you're getting hyperactivity of the right relative to the left. And that's the prime marker for depression. Then, of course, we have deficiencies in the back of the brain, which is a stress situation, anxiety situation. And then, of course, we have the trauma, which is the blunted alpha response. So here's the culprit right here. That's where all of the negative stuff is sitting. And when that gets hyperactive relative to the other side of the brain, relative to the left, that's when we have conditions associated with predisposition to depressed mood states. When it's beta on the right relative to the left, my feeling about that is it's more genetic in nature. That is a genetic predisposition. Genetic doesn't mean not correctable, by the way. It only tells us where it's coming from. When we get elevated slow frequency in the left relative to the right, meaning that the left is blunted, subdued, those conditions, in my experience, are more related to experience. That is, an individual who has had some near negative experiences that are giving rise to depressed mood states, feelings of lack of success, and so forth. And then we have the stress related conditions associated with particularly springtime seasonal affective disorder, and that's where there are inefficiencies in the brain. The brain is just not good at stress tolerance, the ability to process good quality sleep. So sleep quality is associated with that. And when you have problems with sleep, of course, then that can trigger uh, depression, and light can have an effect on that because subdued light affects the circadian rhythm, which affects our sleep cycles. This is what I consider to be the typical case of somebody coming in and they have been diagnosed with seasonal affective disorder of the fall variety. And what it is, in my judgment, is that it gets worse in the fall. So this is the seasonal affective issue is part of a broader mental condition. It's part of depression that they experience more or less throughout the year. It's just exacerbated in the fall, and it can be exacerbated for psychological and or neurophysiological reasons. So this person, if we look at up over CZ, we're not seeing any problems there. If we look at the back of the brain, that's really not a problem. A lot of folks like to be in this range, about 1.7 in the back. But here's the culprit right here, and that is where the right side of the brain is considerably more active than the left. And there's your marker for predisposition to depressed mood states. And this individual also has an additional marker here. And this is a marker sitting up over the front part of the brain. Okay, it's sitting right up in this area here. And when you get elevated activity of that region in the brain, it's an area referred to as the anterior cingulate gyrus. It sits in here. The cingulate gyrus runs the entire midline, but the anterior portion of it is up in this region. And when that's elevated in this fashion, then the individual is fretting. So we have an individual who is worrying about things, fretting about things, can't get things off their mind. They're predisposed to depressed mood states, and they are expecting depression because their depression always gets worse in the fall. This isn't really, in my judgment, seasonal affective disorder. This is depression that happens to get exacerbated during this time of year. So what we do for this is go right after this, balance the front part of the brain, and take care of the neurological cause, predisposition. This is the condition that we were just looking at, in which there's elevated activity in this region, so there's a lot of fretting going on, and a neurological genetic predisposition to depressed mood states. And that's where beta is elevated in the right relative to the left.
Okay, and we have a few more questions, so I'll get right to these. Dr. Swingle, I get depressed at Christmas time. I just hate it. Is this sad?
Yeah, it is sad. Whether it's seasonal affective disorder or not is another issue. A lot of folks really don't like Christmas, and for all kinds of reasons. So my guess is that if it really is triggered right around Christmas time, that it's much more likely to be reactive in nature. That is your expectation of this being just a terrible time of year for you. If you really had seasonal affective disorder, it would start to kick in much earlier than that. So that's my guess. Now you may have a predisposition to depressed mood states, and your expectation of just being really sad at that time of year for loneliness or all kinds of reasons may be triggering it.
I got really depressed last year and my doctor told me to go to Arizona for a vacation. I went and got worse. When I came home, I took some antidepressant medication, which seemed to help but made me very fatigued. Was this season's disorder?
I don't think so. I think what you probably had was that condition that we referred to a little earlier of deficiency in the back of the brain. So my guess is that your condition was more stress and anxiety related as opposed to depression. And when you went to took a vacation in Arizona, it probably well, you just said it exacerbated it, and that's quite common. And antidepressants usually don't work for this kind of condition other than if they give you enough to sedate you in a sense, your fatigue factors. So my guess is, this was not the seasonal affective disorder of the reduced light type. This was seasonal affective disorder of the springtime variety that we were talking about earlier. And you became anxious about something, and that was exacerbated by the increased light, would be my guess.
Hello, Dr. Swingle. Can melatonin reduce seasonal affective disorder?
Probably not. There's pretty good evidence that you should that in seasonal affective disorder you're getting an increase in melatonin. So and you're more prone to have increased sleep, oversleeping, and so forth. I'd be much more inclined to have a very strict and rigid sleep cycle. Go to bed at 11, get up at 6 a.m. That would be my recommendation as opposed to melatonin. If you do take melatonin, make sure you take an extremely low dose, half a milligram, for example.
I love the fall and get happy. Is this unusual?
Not at all. A lot of folks like fall. You have the wonderful change in trees and colors, and holiday season coming on. A lot of folks get really happy around this time of year. So maybe this is a seasonal affective disorder. I mean, affective doesn't mean necessarily sad. We just think of it that way. So you have a positive seasonal affective disorder. Good for you.
Okay, thank you for your questions. I just wanted to let you know that we will have a recording of this webcast posted on our website, swingleandassociates.com, in about a week or so. All of the previous recordings are there as well, and they are on the webcast page, which is the same page you use to log in to this show. And we will move ahead.
Okay. One of the very efficient ways of dealing with seasonal affective disorder or depression that becomes exacerbated at this time of year is referred to as brain driving. Now, what brain driving is it's a form of neurotherapy in which we measure a particular aspect of brain functioning. Based on that measurement, we stimulate the brain with light, sound, microamperage stimulation, EMF fields, and so forth, to nudge the brain, push the brain into more normal functional ranges. These are the kind of glasses that we use often. Now, this set is one in which you can look right through the glasses because the lens is clear, and these are the lights around the periphery of the glass. So we can turn those lights on and off depending upon what the brain is doing. This is the kind of client preparation that we use. This is what a client is exposed to. So we're able to present sound. We're able to present lights, and with the light glasses I just showed you.